Suggestions could become mandates soon in the counties covered by the Central District Health. That includes Ada, Elmore, Boise, and Valley counties. During last night's CDH meeting, a motion was made to convert the current health advisory into a health order. There's a vote set for Friday evening. The difference between an advisory and an advisory is CDH asking the public to please take certain action. An order, well, is telling them to. The current advisory asks businesses to change their practices and people to avoid social gatherings to cut down on the widespread community transmission of COVID-19. As we told you yesterday here on the 208, Treasure Valley Hospital's not quite full, but they are headed in a very wrong direction and they're very busy. Joe Paris spoke with two CDH board members today about their view on a potential new health order, as well as the CDH director about what they are working to accomplish.
I think they're very much in a very significantly stressed situation.
Central District Health Director Russ Duke says the draft health order his team is working on will not be a copy-paste from the current advisory, but it will look similar. The current advisory includes guidance like asking people to limit their gatherings to 10, gyms to limit capacity to 50%, and asking restaurants to really focus on doing to-go and carry-out service.
We're just trying to figure out where exactly the greatest risks are and the least restrictive approach to keep our hospitals from getting overrun with COVID patients.
The board was not unanimous, though, in asking for a draft order to vote on for Friday. Elmore County Representative Megan Blanksma says she has some concerns.
The reason for that is I think that it's a big enough issue that the public really needs to have time to review it and understand what's going to happen.
The draft order is expected to be posted Wednesday evening, giving people from then until Friday evening to review and give input. Blanksma adds that the current advisory includes a section at the bottom that laid out when it would convert from an advisory to an order. It reads that if one of the three health systems in the area implements crisis standards of care, the advisory will become a public health order.
When we made the recommendation, we set a tipping point from a recommendation to an order. Now we're getting out ahead of that, and that wasn't what was advertised to the public in those recommendations, and so I have concerns about that.
Blanksma adds that not having the hospitals weigh in during the meeting on Tuesday is also an issue. She explains that because the wording in the advisory is specific to them, that she would like to hear from them and see their hard data. Director Duke says he has a different point of view on that wording.
That's the end of the line. When we get to that point, there is no choice, but it was never intended to have the board not have the opportunity to contemplate orders ahead of that crisis situation occurring.
Our goal is to preserve healthcare capacity, and if we can't do that, we will have failed.
Ada County Board Representative Diana Lacciando voted in favor of having a draft made to vote on. She took to social media after Tuesday's meeting to address critics who said the board was going too far if they did things like having businesses change their practices or ruled out other things like having youth sports.
If your first reaction is to message me about sports and not that our ICUs are full, we need to think about that. And again, I get it. It's hard. People are frustrated. They're sick of it. But this is about something bigger than what our individual desires are.
Lacciando says these are tough decisions, but they're made with keeping the community healthy in mind.
I'm just going to keep listening to the epidemiologists, listen to the healthcare leaders, and make the decisions as best I can.
Blanksma says she understands the gravity of the situation, but believes there isn't just one path forward. She wants to make decisions to keep people healthy and is focused on that heading into Friday.
I'm going to listen and keep an open mind.
All right, Joe, from my understanding, that last segment you talked about where it would go directly into an order, that was kind of one of those things set up that if we crossed that threshold, it could go there without having a meeting to vote on it, basically. So that's kind of been what the point of contention is for Blanksma. But what about enforcement? So they vote on this on Friday and they make it an order. How is that going to be in effect?
Well, the health districts, they have the ability to have a misdemeanor penalty on the books. But one point that's been made, and specifically when I talked about it with Representative Blanksma, you have to have the local law enforcement, the police officers, the local sheriff's department on board to enforce it. As we've seen before, you can have all kinds of health orders and rules on the book, but if you don't have the cooperation within the community to actually get that enforced, it's almost a moot point. We're expecting to see this draft order come out here really in the next hour or half hour or hour or so, Brian. So we'll get an idea of what's on the table for Friday, and we'll be sure to update our viewers about what the enforcement looks like and specifically what some of these orders will really entail.
And as you mentioned with enforcement, we've seen police agencies across the state already step up and say they're not going to touch it. So we'll see how this plays out. All right. Thank you very much, Joe.